lifestyle medicine mean to me? I believe lifestyle medicine is not an esoteric part of healthcare. So many words have been used: integrative, alternative. Lifestyle medicine to me is the foundation of healthcare. It's something that we tend to ignore or not address, but it's the things that are, I think, most important to a patient's prevention regimen, to their future health, to helping resolve the diseases they have. For me, lifestyle medicine is a stack of several things that come together that a patient can do by themselves. One is exercise. And it doesn't have to be complicated. It can be very simple, but getting out and moving the body, we found that moving the body is the most important thing for longevity and really enhancing your human experience. The second is good diet. And again, that's not something esoteric. It's more fruits and vegetables. It's moderation. It's understanding how foods affect you in many different ways. The third is sleep, making sure that we sleep well. We get good sleep, the right amount of sleep, and understand what affects our sleep. That's often ignored. I think the fourth is how we deal with stress. We can't always get rid of stress in our lives, but there's things we can do different that make our reaction to stress better. Reducing our cortisol level. All day long we fight the tiger, and our cortisol is raised, which influences insulin, influences glucose, influences inflammation, which then causes many different things in the body. I think the next are understanding not to smoke. Smoking has no place in healthcare, in health. It's one of the things we've ignored in the past, but now I think it's pretty well stated. The next is alcohol, understanding the place for alcohol, that, alcohol, unlike the other macros in the body, the fats, the carbohydrates, the proteins, the other micronutrients, the body doesn't know what to do with alcohol. And so we found that there's almost not a good side to alcohol, but I say in moderation, and many people 1 or 2 drinks a week to satisfy that need to have alcohol is a good thing, but understanding the effect it has on your body. The other is around social engagement and living in love and not fear, and understanding how to be a spiritual being in a human body. And this, to me, is the one part of healthcare I think we're going to move into. It's almost like being a quantum physician over the next few years. So understanding how to help someone socially interact, understand the things that have affected them in their early life that may prevent them from being connected to other humans in ways that ease their burden. And when you wrap those 6 things plus many others into a package of care for someone, it's more than treating their diabetes. It's more than treating their hypertension. It's more than treating them through menopause, or as a man ages, through what they go through. It's helping individuals become more holistically cared for so that they live a longer, healthier life, something we call health span now. Their human experience is enhanced not only through good health, but health care, and we reduce their suffering, their mental emotional suffering, their physical suffering, and the suffering that comes along with just not being cared for. Hopefully that makes sense. That, to me, is the foundation. I'm not against using medicines. Medicines are a great thing with healthcare and health, but I do think that the foundation needs to be those: good sleep, good diet, good exercise, dealing with stress really, really well, being emotionally connected to those around you, avoiding cigarettes and other tobacco, and minimizing your alcohol.